One day, a woman we'll call Mrs. Sophie Dupont comes to the emergency room, accompanied by her husband, because she's complaining of abdominal pain. Mrs. Dupont is admitted and settled into a room, while her husband goes back home to fetch some of her belongings. When he returns, late in the evening, he introduces himself to the night nurse, who tells him which room Mrs. Dupont, his wife, is in. The nurse does specify, however, that she needs rest, so he should leave the light off so as not to disturb her. Her husband then stays with her all night, gently holding her hand to support her through this difficult time. Suddenly, Mrs. Dupont feels very unwell. The monitor beeps and the nurses are called in for backup. Total panic. They escort the husband out, asking him to wait quietly in the hallway. Long minutes pass. The nurses finally come out, looking dejected. Mrs. Dupont has just passed away. The husband then bursts into tears, devastated by the loss of his wife. Afterwards, he begins calling all their loved ones, family and friends, to break the sad news to them. A few hours later, when he is asked to sign some papers, he notices that the first name written is Mrs. Josiane Dupont, not Mrs. Sophie Dupont. After checking, it turns out that there were two Mrs. Duponts in the ward, in two rooms next to each other, and the night nurse had not indicated the correct room. In fact, the husband had spent the whole night with Josiane Dupont, 60 years old, and not his dear wife, who, by the way, was doing just fine and sleeping peacefully. All's well that ends well. Except for Josiane.